for her to join us and talk on her topic, which is success and less stress in the IEP process. So this will be recorded, and anybody who was not able to make it, or if you need it for reference in a future time, you'll be able to find that on our website. And we'll go ahead and turn that time over to you, Erica. Thank you so much for joining us today. We really appreciate it.
Thank you so much. I'm excited to be here. Let me share. It has decided that sharing screen is disabled.
Okay, let me work on that because it said that I can share my screen. Let's see. Okay, how about that? Does that work?
Yes.
Okay, great. Perfect. Thank you.
There we go. Okay. Let's present that. Hopefully everyone can see that. Like she said, my name is Erica Lopes. I am a BCBA here in the Salt Lake City region. And today we're going to be talking about how to make that IEP process a little more successful and a little bit less stressful for parents. A little bit about Autism Learning Partners, which is the company that I work for. Autism Learning Partners began working with children with autism in about 1988. So we've been around for about 33 years, though we are newer to Utah. We've only been in Utah for a couple of years, but overall they've been doing this for a really long time. We provide services, ABA services, to children and young adults with autism and other developmental disabilities. And we also accept most major insurances, including Utah Medicaid and Select Health. And I'll have more information on that if you have any questions about intake or questions about possibly working with the company towards the end of the slides. A little bit about myself. I'm a BCBA with 6 years in the field and experience working with children with developmental and learning delays. I've worked alongside parents in schools in multiple counties. I've worked with private schools, public schools, Catholic schools, Montessori schools. The IEP process is universally used, as it were. I am currently the behavior analyst for ALP's Salt Lake City, Utah location. We serve Davis, Utah, and Salt Lake counties, doing in-home, community, and school-based services for children with autism and other delays, which is really fun. So what is ABA? I know ABA is a term that kind of gets used a lot, and if you don't already have an ABA provider, you've probably heard it mentioned quite a bit. ABA is a discipline of psychology devoted to understanding and the improvement of human behavior. We specifically focus on teaching children skills in the areas of communication, adaptive living, social and emotional behavior, although ABA isn't limited to just children, but for the purposes of this presentation and what I do, we work with children. ABA is used to change behavior by evaluating the functional relationship between a behavior and the environment. And all that means is that we help children or people or adults make better behavioral decisions by figuring out why they were doing what they were doing and helping them find an appropriate replacement behavior. Goals and instructions are individualized to each child and incorporate in their daily routines in the natural environment. The biggest goal with ABA is that we blend into your natural environment so that we can help with what's really, really actually affecting the family. A lot of times with one-on-one psychotherapy or things like OT, which are all wonderful support services, what they learn doesn't translate into home. And with ABA, because we're in the home, it does, which is really important. And we also incorporate parent training and involvement in the child's program, which is part of what we're going to talk about today. So What we're going to cover in today's presentation are the components of an IEP, which is an individualized education plan, tips to ensure success, and what my role is, or what my company's role, or similarly another ABA provider's role would be within the IEP.
Erica, I'm sorry, is your screen showing something besides a circle?
Yes, mine is showing a whole presentation. Are you guys not seeing my presentation?
Does anybody else see anything but a circle?
My screen sharing is paused.
Yeah, I only see a circle.
Okay, let me, oh,
Maybe. Does that work?
it says, yeah, now we got it. Thank you.
Haha. I was like, for some reason it paused it. I don't know why I did that. Haha. Okay. Sorry about that, guys. Well, all you missed was exactly what I talked about, but like I said, this is what we're going to be covering today. Oh, thank you for letting me know that. I didn't even notice. The joys of technical difficulties. Components of an IEP. So an individualized education plan is a working document that outlines the plan to address your child's individual needs. The meeting that you'll have, in these meetings occur about once a year, is intended to discuss the assessment outcomes, present your child's current levels, review progress on the goals that they already have, maybe propose some new ones, and then identify what support is needed for your child to access their learning environment. So just like it says in the title, it's very individualized. Each IEP is going to be different. But it's still important that we make sure that they're actually addressing what needs to be addressed and that they're going to be successful for your child. And when we say working document, it means that it can be changed, and it should be changed, and it should be growing and adapting with your child's needs. IEP attendees. So the members of the IEP team include your general education teacher. So this should be your child's teacher. If they're in the special ed program, then also their special education teachers and maybe their para. A school representative. This is usually a vice principal or a principal or a case carrier. Of course, you guys as the parents, you can bring the student if you want. A lot of times this meeting is a little boring though, so kids often choose not to come. And anybody else with special expertise about your child. So if their IEP includes speech services, physical therapy, adaptive PE, occupational therapy, things like that, those will all be included in the meeting. You can invite outside professionals to attend the IEP if you think that they would meaningfully contribute. So if you have private OT services, a private SLP, and of course, an ABA provider like myself, you're welcome to bring them. What I found and what parents have kind of given to me feedback wise in the past is that the more people are there, the better continuity of care that we get for a child, and the better the meeting seems to go. And sometimes it's nice to have that outside support and someone who can kind of back up what you've seen and has another perspective from your child other than just what's going on in school. Before you bring anybody, the school team should be notified in writing of additional participants, and any legal documents need to be completed ahead of time. So typically a release of information should be signed with the company and with the school before we go to the IEP, just as a measure of HIPAA and to protect your child's protected health information. So what to expect? IEPs are done, like I said, once a year, so about every 365 days. Some kids have them more frequently. If that's what's needed, you can request that they be held sooner, or any other team member can as well. Parents should be notified about the IEP meeting at least about a week before, 5 days before the meeting date, though you will typically get it before then, in my experience. The invitation should include the date, time, location, and the names and titles of everybody that's coming. And once you're notified, this would be the time to let them know, hey, I'm going to bring my home BCBA, or we're going to bring our home speech therapist, things like that. Once the meeting starts, you will be given a copy of the Utah Procedural Safeguards Notice, which is that big old packet that they give you right at the beginning. And the IEP team will discuss your child's strengths and weaknesses in the school environment. Typically, the way that I've seen this done here in Utah is they'll go around the room, everybody introduces themselves, and then everybody kind of goes in turn and talks about their contributions to the IEP. So your speech therapist will talk about assessment results and their program. And then the SPED teacher will talk about their assessment results and their program, and the school psychologist, and so on and so forth around the room. Parents are encouraged to be an active participant in this conversation. I think it's a little bit easy to feel kind of bulldozed by that conversation. It's a lot of information all at once, but the best thing that you can do for your kid is to be active and to be paying attention and to really make this a conversation and a back and forth instead of just people talking at you. Tips to ensure success. So one of the ways that you can make this more successful, make this a more meaningful conversation, is that when you get notice of the meeting, you carefully understand what will be reviewed. So under the most recent reauthorization of IDEA, which is the legislation under which IEPs occur, districts are encouraged to consolidate meetings. So like I mentioned, you'll be reviewing the results of all of their test results and their assessments, as well as their programs and their goals and all of the work that they've been doing all at once. So it's a little bit of a longer meeting, but make sure that you read all that paperwork ahead of time so you know what's going on and you know what's coming in the meeting. You can request a copy of the IEP before the meeting. That way you have a chance to review it and kind of go over it. You can go over it in home with someone like myself or another provider, or and you can really kind of get into it and identify your questions. That way it doesn't feel so delayed or kind of on the spot while you're in the meeting. I know when I'm in meetings, it's really hard to remember my questions sometimes, so being prepared really helps there. If you're bringing other professionals with you, you can also share this with them prior to the meeting. Like I said, a lot of times what families will do is they'll send me the IEP right beforehand, and I'll send in, our progress reports and our recent assessments. That way everybody has everything ahead of time and we can just get into it once the meeting starts. Other things you might want to bring with you, especially if your child has recently changed schools or changed grades. A lot of times this happens in the transition from elementary to middle school, or middle school to high school, or even just kindergarten to elementary school. It's a new team. So bringing previous copies of IEPs, anything from your doctors, if they've had a recent diagnostic assessment, these are really good to bring. The progress reports from ABA, which is something that myself or a similar provider would provide, speech, OT, any of that, bring with you to the IEP. It is never a bad idea to have too much information. There's no such thing as too many things. So if you feel that it could apply to the goals and it could apply and it could help better explain your child's needs, then feel free to bring it. And like I said, if you're bringing an outside provider, that's something that we could bring as well. So it doesn't have to all be on you as a parent. So start the meeting on a positive note by taking the time to thank everybody for supporting your child. I think sometimes it can feel really combative to be in these meetings, and you feel really defensive because you're trying to stand up for your child and you're trying to make sure everything's going okay. So starting the meeting on that positive note really sets the tone and makes it a positive experience. Let everybody know at the beginning of the IEP that you have questions that you would like to address throughout so that they can allow time. And then ensure that goals are SMART. So SMART is a little acronym we've come up. All goals within an IEP should be very specific. They should be measurable. They should be attainable. They should be relevant, and they should have time limits on them. And I'll go over that a little bit more in the next slide. If your goals that you're seeing on the IEP do not fit this criteria, then that's when we should be asking questions. That's when we should be taking time and making adjustments. And feel free to take your time. Time is set aside for this meeting. You don't have to rush through it. You don't have to push through to get absolutely everything done really fast. I think sometimes there's a lot of information and it feels very pressured, but you can take your time. This is important for your child, and it's okay to advocate to slow down. So SMART. So the first part of being SMART is that a goal should be specific. Anytime that you're seeing an IEP goal, it should address the specific area of concern. So instead of saying Ethan will improve his reading skills, the goal should be that Ethan will increase his ability to read by reading 30 words per minute out loud with 80% accuracy on 4 to 5 days of data collection. So the difference between these two things that you can see is, one is very generic. It'd be very kind of hard to measure. I could say, well, he read 2 more books. That's improving his reading skills. Whereas the specific goal is very, very clear as to what improved reading means. And that's really important because we need to know exactly what your child is actually working on and not just a generic feeling. The next part of a goal for being SMART is to be measurable. So goals should be worded so that they can be measured using a standard level of competency. So instead of saying Lauren will increase her comprehension by answering WH questions, it should say something like Lauren will increase her comprehension by answering WH questions with 80% accuracy on 4 to 5 days of data collection. So we have an actual measurable goal there, an actual target standard of what we're looking for, because she could answer WH questions, she could answer 1 out of 5, and that's answering, and that's an increase. Does that count as matching her goals? So we want to be really specific, and it should be something that they can clearly see, and you should be able to see. If they give you a graph and they give you the data and they're like, hey, she's been doing it at 75, you should be able to look at the goal and be like, well, the goal was 80, so it doesn't look like we've met this goal. Attainable. So part of being SMART is that goals should be written to be attainable by the expiration date of the IEP. If you have a child that's not reading yet, it's probably not attainable that they're reading at a 2nd grade level by the end of the year. So instead of saying something like Alden will independently converse with peer and adults for 3 exchanges 80% of the time, and you have a child that doesn't make eye contact and doesn't bid joint attention and currently doesn't make conversations, this probably isn't attainable. We want goals to be something that they can actually reach, that are actually reasonable for them. So in this case, we would say Alden will increase his ability to independently initiate conversations and 80% accuracy on 4 to 5 days of data collection. So something that's a little bit more reasonable. And this is a big part of the advocacy process. If you're seeing goals on here that you feel are just way out of reach, or on the other end that you feel are too shallow, that you see at home, that in this case Alden he's conversing fine, but he's not doing it at school. Maybe initiating conversations is too low of a goal. So this is something big in the advocacy part of the IEP, is that it is attainable. Another part of being SMART is that it should be relevant. So goals should address the concerns from the IEP team members and evaluation results in present level. So we don't want to have goals from kindergarten when we're in, 4th and 5th grade. We don't want to have goals that have nothing to do with his current needs. If your child needs to be working on math and reading, we're not going to focus on goals about conversations. We're going to focus on goals with math and reading. So they should focus on what your child actually needs based on the test results that these people are bringing in for you. So instead of saying Josie would choose the correct operation to solve 2 addition, and subtraction word problems with 80% accuracy, we would say something like Josie will increase her ability to solve 2-digit addition and subtraction problems without regrouping with 80% accuracy on 4 to 5 days of data collection. And the difference here is literally the applicability from evaluation results. So we want to, they're both math goals, but one of them, the the correct one in this case, is much more specific and it's relevant to the current assessment results. If that makes sense. Yay. And then the final piece of SMART is that it should be time limited. So all goals within an IEP should have an amount of time for measurement and a time in which they think that it'll be completed by, which is usually the end of the year. So they should be written to ensure that a skill is mastered within the IEP period. This is part of making something attainable and making something relevant and specific, is that, okay, when is he supposed to attain this by? So instead of saying Kane will increase his ability to use appropriate verbal responses 60% of the time, we're going to say Kane will increase his ability to use appropriate verbal responses with 60% accuracy out of 4 to 5 days of data collection. So, 60% of the time could be 2 days, it could be 10 days, it could be 20 days, we don't know. Whereas the correct goal here is very specific about how many days of data collection are needed for that 60% to be considered met. So my role and the role of other ABA providers and ALP specifically during the IEP process is that you have someone who's a special expert about your child. You are the expert on your child. I'm the expert on your child's behavior plan and your child's different assessments and things like that. And we can provide a professional's assessment of your child's skills and deficits. So again, it's just another way for the school to see what's going on outside. If your ABA provider is working on using a device to talk and the school is working on vocal skills, well, those are two very contradicting goals. It's really important that we're all on the same page, and this gives a little more weight to it and can really ensure that we're getting all on the same page and making sure that your child's getting the best services possible. And like I keep saying, we can provide the copy of the most recent progress report with our goals. So it's a good way for us to model other goals that your child is working on and other progress that they've made. Maybe you think that the goals that the school has made are unattainable, and we can look at, his ABA progress report and see that he makes really slow progress and he needs more time. And we have evidence of that now. So when you're advocating for your child and saying, hey, these goals are not attainable, here's the progress report that shows what kind of goals might be more attainable or why it's unattainable or why you feel that way. So like I said, there's no such thing as too much information. And it's really better to have a little bit more. That way we can give your child the best chance at having the strongest IEP possible. So my goal when I'm in an IEP meeting is to collaborate with the school team on goals previous or currently in progress during ABA sessions, letting them know what we're working on again, and what we're going to be working on. And a lot of times teachers and school administrators will give me goals that they think that would benefit the child to be working on outside of school. So again, if a child has a lot of speech therapy goals and they're working on articulation, it might be really beneficial for the ABA program to start working on articulation as well. And that's something that we learn in the IEP. And the other part of my contribution is to collaborate with you and the school team on a behavior intervention plan that will work at home at school. So for kids with really intense problem behaviors, or even not intense problem behaviors, just kids who have difficulty with things like running away from the classroom or having tantrums at school or having aggression and things like that, having your BCBA there helps make sure that what we're doing at home as a consequence for that behavior can also be taught to the teachers and done at school. That way they get that consistency and we're able to see that behavior change and see improvements in that area. Thank you guys. Sorry if I talk a little fast. Does anybody have any questions?
If you do not want to ask, you can put it in the chat, or we can just have anyone jump on and ask any questions. Erica, I did have one question at the very beginning. You said that you can have your paras involved in the IEP. Is that correct?
Yes, it's a lot of times, especially if you have the kid attending, the para will come too. And you can ask the teachers too if they can bring them, since they know the child really well.
And so what do you suggest is a good age to start including your children in the IEP program? I mean, the IEP meeting.
It really very much depends on the child themselves. A lot of times I won't include or recommend including a child unless they can advocate for themselves. So a lot of times this happens around middle school or high school. But for some kids, even older, they just don't quite have the functioning ability to be able to sit still and sit there and attend. And they really can't handle having people talk about them a lot.
Yeah.
So you have to think really critically about what your child can handle and whether or not it would be beneficial for them to hear their test scores, or will it be too overwhelming? So it's very much dependent on who the child is. I don't know if that helped.
No, that did. Thank you very much. Now, autism learning partners, do you have to have oh, I'm sorry, Brandy. I'll just 1 second. Do you have to have a formal diagnosis to work with you? Or if anybody that has an IEP, can they come and get help?
Typically the process, and I can move that slide too. How to get in contact with us. There's contact pages. So typically the process for getting ABA services starts with a diagnosis. So a lot of times people will get an IEP diagnosis from a school, which is not technically a formal diagnosis. And then you'll need to go to a doctor, psychiatrist, psychologist, and get a formal diagnosis done. And once that is in place, then you contact the intake departments and get things moving along.
And do you have places that will diagnose quick? The thing I'm hearing from a lot of our members, it's taking 1 to 2 years to get a formal diagnosis. Do you have any suggestions on how to cut that time down?
That is unfortunately probably the biggest barrier for most families, and it's something that we hear constantly. In Utah, we don't have our own diagnostician currently, but we do have a list of providers that we work with that are a little bit newer, so their waiting lists are a little bit lower.
Oh, that's amazing. Okay.
I think the best I've seen parents do is to contact multiple providers and make multiple appointments and set yourself up to be like, hey, if somebody cancels, just call. But if you contact Janet, who's my personal supervisor, she has that list.
Great. Okay, Brandy, I'm so sorry.
You're okay. You helped me with some of my questions. Yeah, I have a couple questions. My first one being, my son has now transitioned from elementary into middle school, and the difference between the two schools when it comes to the IEP and the attention that they have for the children is very different. So one question I have is, on his old IEP, probably last year or the year before, he did have occupational therapy because he was having some bad behaviors. Yeah. But they did take it off. It's not currently on there. But some of his some new behaviors have come up. And I've been talking to about getting him back on the occupational therapy. And it does state, I had an autism report done probably like 3 years ago, and it did state as a recommendation on that to have him on occupational therapy. But I am also working on getting a new assessment done, because back then they didn't know if it was more trauma based or because they were in foster care at that time. So I guess my question is, do they really have to have the new assessment to be able to get him back onto the occupational therapy, or is that something I should push for when he has his next meeting?
I would still get the new new diagnostic assessments done for sure, just as a general rule of thumb.
Well, yeah.
But definitely I would advocate for him to continue occupational therapy and push through, and possibly bring in those old IEPs and bring in that original diagnostic assessment that shows why he needed it. A good thing I've seen parents do is kind of write down the behaviors that they're seeing at home, so you don't forget kind of in the moment.
Right.
And be like, originally they said this could be helped with occupational therapy. Maybe ask them why they have taken away occupational therapy, because that's a little bit unusual if it was in his original IEP, and just Yeah, don't
Okay.
feel bad pushing for something that you think your child needs. I think a lot of times parents get into these situations and they feel like they're surrounded by professionals and people that know what they're doing, but you are the expert on your child.
Right.
So don't be afraid to stand up for your kid.
Okay. And then the only other question I have is like, so he's expressed to me, I mean, he's doing fairly well in all his other classes, but he struggles in like world history. And I actually went and talked to his case holder yesterday, and she said, you know, they really don't have the aides. They only have one aide. And at the time period that he has world history, they're working with someone else. So is that something that I could actually go to the district and push in that sense? Or is that a bad idea?
It's worth trying. It's hard because everybody's so understaffed, just period, right now.
Right.
There's no guarantees that you can get anything in any direction, but it's worth trying. It's never a bad idea to at least try and see, you know, what the barrier is there, why they don't have more, if they're going to get more. The rule kind of with special education, and it sounds like you've been doing this for quite some time if your child's in middle school, is the squeaky wheel gets the grease. So
Right.
making sure that you're doing as much as you can, even if it feels a little bit excessive at the time, as kindly as possible, of course, but letting them know, hey, this is what he needs. This is what I want. How can we get this?
Okay. And then one more question. I am in the process of getting him another assessment, like I told you, but I'm currently looking for ABA services also. So since he has a past assessment that states in the recommendations that he needs ABA therapy, can I use that to get on ABA through you guys?
You should be able to, yes. If you
Okay.
contact the intake department and just ask them about it, it'll depend on your insurance company. Some
Medicaid.
insurance companies want a more recent diagnostic assessment, but some will accept ones from several years ago.
Okay. Sounds good. Thank you.
Yeah, thank you.
Great. Thank you, Brandy. Does anybody else have any questions for our presenter? Okay, Erica, is there anything you want to leave us with before we end today?
That is all I have for you. I think, you know, just to reiterate, you are your child's best advocate and you guys are the experts in your kid. And I think it's great that you're all here and trying really hard to get that information and just keep going. It's a really hard job and I am in awe of how well parents do. So thank you for coming and thank you for listening to me.
Thank you very much. And nobody else has any questions, right? I don't want to.
Could I ask one actually?
Oh, absolutely, Ashley, please.
Thank you. Sorry, I'm driving. Yeah, I was wondering what would happen if the SMART goals are not met. So for example, I have my daughter's IEP was sent home and I have a meeting on Friday, but a lot of the goals that we have set, I'm seeing like not sufficient progress. And I'm wondering why. Obviously, I'll talk to them about it, but what do I do when they're not meeting the goals that we have set up in the IEP?
There's a couple things. So the first thing is to bring that up. It sounds like you've already noticed. Write down which goals you're seeing not sufficient progress in, and then talk to them about how do we need to reduce these goals to make them more attainable? Do we need to increase her paras? How can we actually achieve those goals and really focus in on them? And very, very specifically advocate for what you have. It's like, it sounds like you're already on the right track for it. But yes, so specifically brings up the goals that are making not sufficient progress. Ask them why she's not making sufficient progress. And then if those goals meet all the other criteria, you know, they have the time limits on them, they feel like they are attainable in the next 6 months period, and figuring out which parts of SMART aren't being met and focusing in on that. So if it's not attainable, be like, hey, you know, I don't think these goals are attainable. This is what she can do. This is what she is doing. These are the goals that are being met. How can we adjust this goal?
Okay. Yeah, a lot of the goals, so she's in preschool. This is her second year preschool. I know, but a lot of them seem to be around the socialization factor, because that is one of the areas that she has a little bit of difficulty in. So I was wondering maybe if it's just because she is having a hard time socializing, or if it's something that they need to be pressing more. So
Yeah.
I'm not exactly sure how to approach them with that, because socialization isn't necessarily something that the teachers dictate. Obviously, it's, free playtime. Let's see what she can do in free playtime. But yeah, anyway, so that was
And
one of my
that's a great question to ask them, is how are they implementing these goals? How are they teaching these goals? What makes it attainable? So if they think it's attainable, what are they doing to help her get there?
Okay. Okay, thank you. I appreciate it.
Yeah, good luck.
Thank you,
Thanks.
Ashley. Are
Yes,
there any more
it is recorded.
questions? Okay, Allie did ask if we were recording this, and yes, we did record it. If you signed up on the Google form, Sylvia will send it out to you in the next day or two once it downloads and she's able to do that. If not, just reach out to us and we can give you that link. Most of our webinars are put up on our website, and you can access them there if we get permission from our speakers, which we did. Thank you very much, Erica. So if there, oh wait,
Thank you.
okay. Oh yeah, Kay said, thank you. Thank you very much, Erica. We really appreciate you coming today and helping us out. Such a scary
Thank you,
thing,
guys.
IEPs, and really, we have the ability to do it. All of us parents do. We just need to have that confidence and sometimes really rely on those people in our IEP team. So thank you so much, Erica, and we'll make sure to give everyone your information. And we
Awesome.
appreciate you coming.
Thank you so much. It was so nice to meet everybody. I hope you all have a wonderful day.
You too. Thank you. Bye.